Hi, my name is Natalie Cronin, and here is a copy of my student ID. My student ID number is 900337195, and I'm about to present to you the evaluation of exceptional children, my final exam for the spring 2019 semester. The evaluation of exceptional children, Natalie Cronin, spring 2019. Some considerations of assessment processes are, these are some standard suggested procedures for all types of assessment. You must always have parental permission before conducting assessments. You need to consider any sensory impairments or physical problems prior to conducting assessments. Conduct a parent interview. Conduct intellectual and academic assessments, conduct behavioral assessments, and then use the data and interpret the results and create a report of your findings. Some additional considerations that you should give are to reduce bias. You want to note any sensory communicative impairments, vision, hearing, speech, and make accommodations as necessary. You want to note background experience of the student that you are assessing. You want to look at the content of classroom instruction and make sure that lack of certain instruction will not limit their responding to items. Does the examiner know the student? Are they familiar to the student? Are instructions familiar and clear to the student? Is the student familiar with the recording technique necessary? So the first area we're going to look at is assessing intelligence. There is a known correlation between performance on an intelligence test and school achievement. It is important to use cross-battery or multiple measures to gain a more accurate depiction. So you don't want to just use one type of item to look at the student's intelligence. One concern is considering minority students. There's oftentimes minority students are more represented in the makeup of intellectually disabled students and are overrepresented in special education classrooms. So you really want to watch those biases when it comes to minorities. You want to be sure that the tests that you're administering are being used in a manner for which they are intended, that they actually are being used for the initial reason for referral. And you need, if you're going to consider someone for a labeling of mental retardation, you need to also provide information from an adaptive behavior scale. You can't just look at the intelligence test. Sorry, that's my guinea pigs in the background. Some commonly used intelligence measures would include the Wechsler Intelligence Scale. That's used for 6-year-olds through 7-year-olds, if I'm reading that correctly, or just before the age of 7. It's a full-scale IQ score. It provides that. It has a general ability index and several indexes for processing scores. So you can look at some different areas to get additional information by section. The Kaufman would be administered to children 3 years old to 18 and 11 months. And that would be administered by a psychologist, not a classroom teacher. And it's based on Luria's neurological processing theory, that the brain functions using 2 modes of processing, simultaneous and sequential. The Stanford-Binet is used for 2-year-olds up to 85 plus years. It has 10 subtests and yields a full-scale IQ score and also a nonverbal IQ score, which could be helpful for students who are nonverbal or non-English speaking students. The Woodcock-Johnson is a general academic assesses general academic areas such as reading, math, and written language. Oral language battery is also available. And the Kaufman Brief Intelligence Test is a screening tool. It's not comprehensive. It's used to determine if a student is at risk for educational problems and needs a more comprehensive evaluation. So we continue on to some additional commonly used intelligence measures. So we can look at some nonverbal intelligence tests, which again would be useful for nonverbal students or persons, as well as those that are not fluent in the English language. So for the differential ability scales, that would be, there's an early year subtest that would be a lower early year subtest that would be used for children 2 years and 6 months to 3 years and 5 months. And then there is an upper early year subtest that would be used for children 3 years, 6 months to 6 years, 11 months. And then a school years section that would be used for 7-year-olds to 17 and 11-month-olds. There's a general conceptual ability score similar to an IQ test or an IQ score. So it's great for students where their verbal skills are compromised, hearing impairments, or students that are just learning English. So the Universal Nonverbal Intelligence Test would be administered to students 5 years old through 17 years and 11 months. It has 6 subtests: a standard battery, abbreviated battery, or extended battery. The abbreviated battery would just be used for screening purposes. The Comprehensive Test of Nonverbal Intelligence, second edition, would be used for 6-year-olds to 89 and 11-month-old, 89 years and 11 months. Authors indicate 3 principal uses. You can use this when other instruments are inappropriate or biased, for comparisons between verbal and nonverbal measures, or research. A test of nonverbal intelligence, third edition, would be administered to students 6 years old to 89 and 11 months. You give the instructions via pantomime. Language and motor are reduced instruments, so there's not a lot of language or motor skills being used in order to answer the questions. And it reduces cultural influence, so reduces bias. The Wechsler Nonverbal Scale of Ability is given to 4-year-olds to 21 and 11-month-olds. Children ages 4 to 7 and 11-month-old, there are matrices, coding, object assembly, and recognition subtests. For 8-year-olds to 21 and 11 months old, you have matrices, coding, spatial span, and picture arrangements. Gestures and oral directions. Instructions are available in English, French, Spanish, Chinese, German, and Dutch. Okay, we're going to move on to the issue of adaptive behavior consideration. So you want to make sure that you measure adaptive behavior before a person meets the criteria for mental retardation. And adaptive behavior is how well a student adapts to the environment. So just because a student scores within the sub-average range on a cognitive assessment does not mean that they're going to be placed with students who have cognitive impairments. There has to be a correlation between the adaptive behavior screening or scales and the intelligence test. So there is a moderate correlation between adaptive behavior and intelligence. It's important during testing to use methods to elicit how much support a student might need in certain areas. So some different adaptive behavior scales would be the Vineland adaptive behavior scales, and that would be used for people 0 to 90 years old. There's a survey interview form, for parent, caregiver, teacher. The teacher form for ages 3 to 21 and 11 months old. So it looks at communication, daily living skills, socialization, motor skills, and optional maladaptive behavior scale. The AAMR adaptive behavior scale is in 2 parts: independent living skills and social behavior. And the adaptive behavior assessment system is for birth to 89, and it's a communication scales for communication, motor skills, self-help, safety, and leisure. All right, we're going to move on to assessing academic performance. Achievement tests are used to measure what a student has learned. Screening tests are not in-depth assessments, but they show where more in-depth assessment may be necessary. And diagnostic tests are going to measure specific abilities, such as gross motor, fine motor, or language. An aptitude test will be something like an SAT, where it shows what a student has retained as far as instruction, but also gives insight into what the student could learn in the future. So it's important to use multiple measures such as achievement test, aptitude, diagnostic, cognitive, and sometimes an adaptive behavior scale to get a comprehensive picture of the student's academic functioning. And all these methods are key components of the RTI process and can aid in identifying areas of need and can help with planning interventions for students having difficulties within the general curriculum. And they can also be used to measure progress, and brief screenings can be used when a teacher suspects that there may be an issue and will give some additional insight as to whether they need to be referred for further evaluation. So let's look at some of the commonly used achievement tests. The Woodcock-Johnson is in an easel format. So you give it to a one-on-one kind of a situation, 3 forms, A, B, and C. There's an extended test book that has additional subtests. There's a variety of specific skills and abilities, and it's based on the Cattell-Horn-Carroll theory, and it's organized into subtests that are grouped into broad clusters to aid in interpretation of scores. The norm group was a range of 2-year-olds to 90-year-olds. The Kaufman test of educational achievement will be used with students 4 years old to 25 and 11 months. It's individually administered, provides standard scores, age and grade equivalents, percentile ranks, normal curve equivalents, and growth score values. The Peabody Individual Achievement Test is in an easel format. There's sections on general information, reading recognition, reading comprehension, mathematics, spelling, and written expression. The Wechsler Individual Achievement Test includes 16 subtests that are individually administered for ages 4 years old to 19 and 11 months old, so pre-K through high school. And not all subtests are administered to all age groups. And it includes areas of oral expression and listening comprehension. So when we look at some diagnostic tests, these are some commonly used diagnostic tests. And remember, diagnostic tests are a more specific area. So that would be math, reading, language, gross and fine motor skills, that sort of thing. So some commonly used diagnostic tests would include the Key Math, which is in an easel format. It's aligned with the standards of the National Council of Teachers of Mathematics. Many items are presented orally. It's grouped into 3 areas: basic concepts, operations, and applications. Process assessment of the learner 2 is also a diagnostic tool for math. It's for K through 6. It's assessing math skills and related processing skills. The test of mathematical abilities is designed to assess areas of math functioning that might not be assessed by other tests. 8 to 18 years old. The Woodcock-Johnson 3 is a reading battery, includes 10 subtests. Woodcock Reading Mastery Test is an easel format, includes 9 subtests and 4 clusters. Readiness, basic skills, reading comprehension, and total reading are included. The process assessment of the learner, 2nd edition, looks at the processes used in initial emerging reading and writing skills. And it may be used when determining if or when a student requires Tier 2 interventions. The Gray Oral Reading Test analyzes oral reading skills 6 years old through 23 and 11 months. And miscues can be analyzed, determines strengths and weaknesses, and documents progress made in intervention. Test of reading comprehension is a variety of task formats: multiple choice, fill in the blank, open-ended questions. Test of written language, 4, has 3 composites: overall writing, contrived writing, spontaneous writing. Individual administration best, but could be given in small groups. And the test of written spelling is a standardized spelling test for 6-year-olds through 18 and 11-month-olds. Can use additional or alternate form to measure gains following interventions. So assessing language, it's going to measure a student's understanding and use of language. It does not include assessments that would be used by speech clinicians to diagnose speech disorders. These tests are more about receptive language, expressive language, and written language skills. So commonly used assessments for language would include the Peabody Picture Vocabulary Test. It's an easel format and helps with planning for interventions that promote language development. The Expressive Vocab Test analysis can determine if weakness is in expressive vocabulary. It can be expressive vocabulary that's used at home or school and determine strengths and weaknesses. And it can also assist in intervention development. Test of language development primary, 4-year-olds to 8 and 11-month-olds. It includes a picture vocab, relational vocab, oral vocab, syntactic understanding, sentence imitation, morphological completion. And there's supplemental subtests for word discrimination, phonemic analysis, and word articulation. And it can assist in educational planning. Test of language development for intermediate is for 8-year-olds to 17 and 11-month-olds. It's constructed to aid in diagnosis of students with language problems. Age equivalents are included. The test of adolescent and adult language is a test of written and oral language assessment for 12-year-olds to 24 and 11-month-olds. When you look at perceptual functioning, we're talking about an assessment that's used when an autism spectrum disorder is suspected. And it includes observation and data collection from a variety of sources. It's important not to just use one source of information and data. It should be developmentally appropriate. You should also include input from parents, teachers, caregivers, and then direct assessment. In looking for literature about this, I found some studies where they were looking at the different types of rating scales, and they talk about how enhanced perception was partly responsible for positive symptoms of autism. So therefore, perception was informative in understanding autistic differences. So we look at how it's really important to see how perception plays into a diagnosis of autism. So let's look at some of the functioning assessments. So the Gilliam Autism Rating Scale is a first step screening for 3-year-olds to 22-year-olds. It's completed by parents, teachers, and other professionals that know the child. And it looks at restrictive, repetitive behavior, social interaction, social communication, emotional responses, cognitive style, and maladaptive speech. So you're looking at how those students are perceiving stimulus and that kind of thing. The PDD Behavior Inventory has a teacher and parent form. It's used for children as young as 18 months. And it has 2 sections: an approach withdrawal problems, a receptive, expressive, social communication ability section. And can also assist in planning for children with ASD. The Childhood Autism Rating Score has 3 versions for children who display characteristic behaviors of ASD. There's a standard version, a high functioning version rating booklet, and a parent caregiver questionnaire. The standard for 6 years or younger and looks at adaptation to change, relating to people, and imitation. Severity and duration are rated and assists in making educational recommendations. Autism Diagnostic Observation Scale is referred to as the gold standard in assessment of ASD. There's a toddler module for 1-year-olds to 30-month-olds, and Module 1 could be used with children 31 months plus if there are communication issues. Module 2 would be a children of any age who has phrase speech, and Module 3 would be for children who maintain inconsistent verbal fluency in daily communication. Module 4 would be administered to verbally fluent or older adolescents and adults. It's a direct assessment, and it assesses all behavioral areas of autism. The Autism Diagnostic Interview. It's an extensive clinical interview and should be completed by a professional trained in conducting interviews, such as a school psychologist, counselor, or social worker, and it can determine if a child has ASD and what additional data might be needed. So assessing behavior, we want to talk a little bit about the 3-tier model. Tier 1 would include school-wide positive behavioral supports. Tier 2 would be where you would have at-risk students in small group interventions. Includes mentoring, discussion of expectations, rewards, and consequences. And Tier 3 is reached when interventions at the Tier 2 level are not effective. And at this time, a functional behavior assessment and analysis should be performed. So some commonly used assessments of behavior would be the functional behavior assessment. This gathers information from interviews, observation, behavior rating scales, checklists, and the like, and it generates a hypothesis about the function of the behavior. And then at that time, an analysis is used to interpret the data. You're going to take your hypothesis and test it and see if you can figure out why the behavior is occurring based on antecedent, the actual behavior that's occurring, and the consequence of what does the student gain from the behavior. So some additional commonly used assessments for behavior would be structured classroom observations, such as a checklist, direct observation form. It's a 4-page checklist, and you rate the behaviors by intensity or severity. You all also can have checklists, yes/no checklists, or severity checklists. The Achenbach, which is also known as the previously mentioned child behavior checklist. There's 2 forms and includes a parent form, teacher forms, and a self-report form for 11 to 18-year-olds. And a behavior assessment system includes rating scales for parents and teachers and a developmental history for parents, self-reports for 8 to 25 years. And this can be helpful in distinguishing ADD, depression, or other behavioral concerns and social maladjustments. The behavior evaluation scale has a short or long form for evaluating students 4 to 19 years old, and there's versions for home and school. And it's best used to screen for possible emotional disturbance. So we also have some other types of behavior rating scales that can be used by the parent, teacher, and students. And you have a Conners rating scale, and that includes a long and short scale for parents, students, adolescents, that looks at ADHD and other disorders that might coexist with attention disorders. There's also the use of questionnaires and interviews. You want to try to be objective, use narrative statements about where the behavior occurs. And a child behavior checklist is unstructured and informal. Sociograms can be used to obtain information about group dynamics, and an ecological assessment is going to look at the total learning environment and includes the student's interaction with others. So some commonly additional assessments would be projective assessment techniques, so sentence completion, drawing tests, apperception tests, and the Roberts 2. So it would be like drawings, sentence completion, fill in the blank kind of things. Looking at picture story cards to see depictions of human figures in situations with family and peers, and they would gather information that the student shares about those different situations, and you would gather information about aggression, anxiety, and social cognitive functioning. So some assessments that you would use for attention disorders would be computerized continuous performance tests that really look at impulsivity and loss of attention. So when you assess physical development, you're oftentimes talking about our younger children, and you want to consider that a lot of this physical development is monitored by physicians. You want to look at some of the important information about the child's health history, such as regulatory disturbances, social environmental disturbances, psychophysiological disturbances, developmental delays. And the prenatal, birth, and early neonatal health history is very important, so you definitely want to get that information from the parent. So some commonly used assessments for physical development. Formal assessments would be the Mullen Scale of Early Learning. That includes an area on vision, gross, and fine motor development. The AGS is a screening profile, and it looks at imitating movements, walking a line, standing on one foot, heel-to-toe walking, standing broad jump, and then some fine motor skills like stringing beads, drawing lines and shapes, and completing mazes. The Brigance Early Childhood Screen looks at fine motor, graph motor, gross motor. And the Brigance inventory is a criterion referenced format and includes gross motor and fine motor skills. The developmental indicators of the assessment of learning includes motor skills for 3-year-olds through 5-year-olds and 11 months. So some additional alternative methods of assessing physical development might be a play evaluation. It's a naturalistic setting. You can observe different types of play and see that physical development and that physical piece. Observations at school or home can also be helpful, as can arena assessments where the multidisciplinary team observes the student. So when we look at assessment of social emotional functioning, you are thinking about self-management, engagement with others, amity, negative emotion regulation, and open-mindedness. And you want to assess pro-social behavior, social skills, initiative, self-control, self-regulation, compliance, interpersonal interactions, and attachments. So some tools that you would use, some of the same tools that you use for physical development screening and for the younger children include social emotional area. It's important to get a lot of information from parents in screening profiles and checklists that are completed by parents, teachers, or both. It includes a self-help and social profile in the AGS early screening and how the child gets along well with others. The Brigance inventory also includes a social emotional section and includes a listing of possible objectives that you could include in an IEP or IFSP. Developmental indicators for the assessment of learning would be used to screen young children who may need additional assessment or intervention and includes social emotional section. There's a parent-teacher questionnaire, and it's available in English and Spanish. Again, we look at play evaluations, another great way to look at that social emotional piece, and you can assess behaviors, again, in a natural environment. You can also observe frustration tolerance, communication skills while they're playing, and just additional observations when combined with parental questionnaires and formal measurements can give a holistic view of developmental progress in this area. The Ages and Stages questionnaire can be used to assess self-regulation, strengths and challenges with self-regulation, communication, compliance, interpersonal interactions. The Social Skills Improvement System can be used for children 3 months to 19 years old, and it has individual rating scales with parent, student, teacher options, and assessment of an individual social skills. The Devereaux Early Childhood Assessment Program has parent, caregiver, teacher scales that assess initiative, self-control, and attachment. And that's my presentation. Thank you for watching. There's my bibliography.